I'm going to talk about separation anxiety disorder, completely different than separation anxiety, which I think we've all seen in small kids. We've all seen it in particular at the school gate. First school, classic tears, clinginess, don't want to go to school. That's separation anxiety. Small kids get it. You'll see it the first day of play school, first day. This is smaller kids. What I'm talking about is something that happens in older children and in teens. So at the moment, we think about 4% of children and about nearly 2% of teens get this condition. Um, and it is much more severe. I have to emphasize this. This is a much more severe um, condition than just the normal separation anxiety that we see in the smaller kids. So, it is debilitating. It becomes interferes in their school life in particular, but it also interferes in participating in other activities. They can't go on sleepovers. They can't participate maybe in after school activities. So it's quite debilitating for the children and teens. It's an extreme form of distress at being separated from their main caregiver or parents or from family members. So it is a much bigger problem, and I have to stress this, that it is a much bigger problem and therefore needs professional assessment and support. So this isn't one you can resolve on your own. So please be aware of it. Please be aware that it does need professional assessment. So what would we see in symptoms? So as I said, if it's going to happen, and this is not set in stone, okay? We would usually see it around 8 or 9 years of age, but it can occur in teens. It's not unusual for that. It can occur at any stage. And why I'm emphasizing that it is because it can occur because maybe the child was ill and had a break from school, maybe they were on their summer holidays and suddenly it happens. It could be a traumatic event, and remember what we're not quite out of it yet, but we're coming out of it, and children are starting to go back into the classrooms and that. So we have had a pandemic, and that is considered a traumatic event, a high stressor, something that can cause you post-traumatic stress disorder. The other thing I want to emphasize in this before I get into some more details on the symptoms is, each child is unique. So please trust your gut instinct. You know your child. Please, please, please trust your gut instinct and go and get help for your child or your teen much quicker than you would with an adult. Always do that. The other thing I would say here is that some symptoms are similar to other health conditions. So, go to your doctor and get this ruled out. And in fact, when I come to treatment, I'm going to talk about that. You'll have to get that done. You'll have to get other conditions, medical conditions, ruled out as possible causes before they will just diagnose separation anxiety disorder. So, most common, most common symptoms that we would see, it's not all the symptoms, but the most common ones that we would see would be this overwhelming sense of fear that something's going to happen to their loved ones, or some sort of unprecedented event is going to happen that will lead to them being permanently separated from you. So they have this huge fear and worry and anxiety about something either happening to you or another family member that they're close to, or that they're going to be permanently separated from them. So then you would see something like refusal to go to school. That is the very, very common one. They may have started by withdrawing from their activities first off. So if they had a regular soccer game, or if they did art or music, they might start to withdraw from all that first. And then it'll be the refusals to go to school. Reluctance to go to sleep at night. They don't want to go to sleep. They can also have physical symptoms, headaches, stomach pain, muscle tension, and other physical complaints that you'd hear of them complaining about. Constantly worrying about their own personal safety, but also your personal safety, as I said, being very clingy, teary when they're having to leave you. Again, we have to think about this. Teens, we often think, oh, teens will be grand, they're fine, they're bigger, they're older. Even older teens, and I'm talking about, seniors, 17, 18, 19-year-olds, can revert back, to that 3-year-old, 4 or 5-year-old that's clinging and teary and doesn't want that. Don't ever dismiss that as them acting stupid, because they're not. Okay, for them it's high anxiety. Nightmares are common, particularly around separation and loss, but nightmares in particular. Inability to sleep away from home. So as I said, anything to do with not being at home is going to be a problem for them. Not just, not being able to sleep, do sleepovers and things like that. Panic attacks can start to occur, and temper tantrums, even in that older age group. I've seen 13 and 14-year-olds throw temper tantrums as good as a 3 and 4-year-old. 2, 3 and 4-year-olds, they will throw temper tantrums, but there's usually an underlying something going on there. There's usually something there going on that you want to be mindful of, and you want to investigate. Always investigate as a parent. So what would cause this? As I said, we've just come out of it. We're coming out of a pandemic. Fingers crossed. So it would be a traumatic event. That's what we class a traumatic event, and can cause, as I said, post-traumatic stress disorder. But with separation anxiety disorder, there are biological and environmental factors that can influence a child normally getting something like this. So it could be genetic. Genes can play a part in this one. It can be learnt as well, I'm afraid. They pick up on other people's anxieties, close family members' anxieties and fears. Not necessarily the parent, but somebody they're close to in the family. So they can learn this behaviour from somebody else. Changes in environment can also trigger it. Moving house, school, even moving a change in activity, some sort of care provider that they've gotten close to. But as I said, it's stressful. Anything that we would class as a stressful event or a traumatic event. So again, high on the stressor lists: divorce, separation, loss of a loved one, so grief. So anything like that we would normally see, they can also cause this condition. There is also an argument put forward for insecure attachment style, or being, overprotective parenting styles can also cause this to come up for a child. Treatment, as I said, this needs professional assessment and then support. The caveat is the child psychiatrist or child psychologist is going to require you to have all other medical conditions ruled out. That's standard for any assessment. Even if you were going for a learning, an educational psychologist report, an assessment, they generally want, everything assessed. So they want to rule out all other conditions. So you'll have that done first, then you would be referred on to a child psychiatrist or a psychologist. And then the treatment depends on the child's age, their health, other symptoms, because sometimes it's not on its own separation anxiety disorder. So we want to, we want the best treatment for our child and what they need. So it's going to be tailored with everything. Treatment should always be tailored to the symptoms, the child's age, their health, and what they need, what needs to be treated for. So generally, though, it's cognitive behavioral therapy, play therapy will be incorporated there if needed. And this is going to be, help the child. Cognitive behavioral therapy, and that is going to be helping the child manage their anxiety. They may need medication. That will be decided by the GP and by the psychiatrist. That's who you're seeing. Family therapy is very common as well, and this is very important for you. And also individual therapy for you as the parent is going to be very important as well, to help you get support that you need, and the family to get the support they need. And it, because the child, it's never in isolation. If a child or a teen has a condition, it's never in isolation. And in order to support that child, you need to support the family and you need to support the individual parents. So it is quite common to have family therapy and individual therapy for the parents. And then, if you're helping yourself, you can also you're helping your child. The other thing here is getting the school involved. And the reason we would get the school involved is to enable supports, because as I said, the focus can be getting the child back to school, and we want them when they go back to school to have the correct supports there. So that would be a reason why we would get the family involved, get the school involved, sorry. So how can you help your child with this condition? And the thing I would say to you here is, the first and foremost thing is, if you suspect your child has anything at all, go and talk to your GP, get help and support for your child. You need to get professional support here. That's the key. If family therapy is offered, please take it. Individual therapy for yourself is also going to be very, very helpful for you. This is going to help you understand your child's diagnosis, because a lot of time you're going to be dealing with maybe a few different professionals. They're going to be talking a language you may not understand. But if you have somebody that you can talk to, they'll be able to explain it a lot better to you, and help you to understand how to do it. They're also going to be able to give you tips to help in your own child's recovery. So not only will your child will be getting support, and that therapist will be able to give you tips to help your child, but you'll be getting more tips to help yourself, to help your child. And it's really, really important here to do that. The other thing I'd say to you here is, make sure you get yourself educated about your child's condition. I always say this. So your child has separation anxiety disorder. What does that mean? Make sure you can explain it to other people, particularly teachers, particularly to other maybe groups that your child is, leaders that their child is involved in. So that could be the sports coach, that could be the music teacher, whoever. They're not going to know about these conditions. Just because the person is a teacher, do not assume they understand your child's condition. Never make that assumption, not necessarily. So make sure you're getting them educated, and you can educate them. That's part of your role. You're an advocate. You're becoming your child's advocate, and eventually teaching your child to become their own advocate as they get older, and they can then be their own advocate eventually as an adult. So you can help them. The second thing that this helps you do is, it helps you be more sympathetic to your child's struggles. When you understand the condition itself, and you talk to other parents of children that have this condition, then you're more likely to be more sympathetic. And the reason for that is, separation anxiety disorder can be very isolating. So we need really to be really on the ball here with kids. So, don't cover things up. This is another tip. Don't cover things up. Take the time to talk with the child, and the other children in the family, and yourself and your partner. But more importantly, you need to listen to this child. You need to listen to what's really being said, and to respect their feelings. You mightn't think that's ridiculous, but to the child it isn't. And I'm not just, when I say child, I also mean teen. It's not. To them it isn't. And as I said, separation anxiety can be very isolating. So it's important that they get reassurance, they get love, and they get support, particularly at home. That's the one place they really need this. They need this. The other thing I'd say to you is, you have to praise every effort. Every small win is in fact a big win when it comes to this condition. So it doesn't matter how small a thing they do, a smallest step, and you'll get steps that you'll be able to take. The therapist will be able to give you steps that'll indicate we're going in the right direction, what to look for, how the progress that they need to make. You'll get that from their therapist. So everything, every small win. So if they don't make a fuss, if they don't act up, if they don't get a temper tantrum or whatever it is, then you need to be praising them. If something is done and it's really easily done, then don't forget to say, God, well done. Well done for doing that. And it can be something simple. It can really be something simple. It doesn't necessarily mean that they're heading out the door to school. Maybe it's just you've arranged for a tutor to come to the home. You can do that through the school. They're very, very supportive at organising that. And I'm talking about in Ireland here. You'll have to investigate that in your own jurisdiction. But they are very good at putting supports in place like that, where the tutors come to the home. You know, taking part in the class with another person in the home can be a huge step for that child. It may seem like a small one for you, but it can be a huge one. Maybe just going as far as the supermarket with you, even if they sit in the car with the other parent, that's a huge step. So you've got to think about it. Where are we at, and what's a big and what's a small win? But small wins, even small wins, even small wins should be praised. The other thing I'd say to you is, keep calm. And this is probably something your child's therapist is going to talk to you about, is, anticipate separation difficulties that might arise. So, making a list, this is a very practical one. Make a list of times, events, situations that might cause high stress for your child or teen. And what you would do there is we would rate them 1 to 10. And then, you're going to be trying out, well, if this is going to happen, then, we have strategies. And the therapist will give you strategies in place to relieve the anxiety. Now, I've already given a lot of anxiety relieving tips for kids. I've done a whole video on that and a blog on that. So I'm not going to go into that, but I have linked to it in the blog. So there's a link to that in the description below. You just link in there and you'll see it. The tip on keeping calm and trying to anticipate when separation anxiety difficulties might arise. In that you'll see tips to help relieve anxiety in children. But the first thing to do is to list those situations, to list those events and rate them 1 to 10. So 1 would be the least. It'll cause the least amount of friction. So that might be going in the car to you to watch another sibling soccer game, and then the most, number 10, would be the worst situation they can face, and that might be going to school. It's going to depend again on your child. So you're going to have to determine which is on a 1 and which is on a 10, or where they come on that scale, and then use strategies that the child's therapist will be able to help you with, and also your own therapist and family therapy are going to help you here too, on how you can help them overcome and face those anxieties and fears, and be able to participate in those activities and events, or face up to them at least with less stress for them. Another practical tip is to provide a consistent routine for your child. Children with separation anxiety, they really need a consistent routine here. So even when the condition lessens maybe, and they are going back to school full time, they still need that. They still need steady and consistent here. So bedtime's the same time, getting up is the same time, meal time's around the same time. Everything is kind of running like clockwork almost. And that can be quite difficult. It really can. And yes, there will be times when something else comes up. Maybe you're going to a wedding. Maybe it's a friend's birthday and you're going to them. Maybe you're going out to dinner with friends, or just as a couple. You need to prepare this child, this teen, in advance that changes are going to occur. Yes, there are emergencies where you're not going to be able to, prepare them in advance. But for the most part, we keep the routine consistent. And if something's going to come up, using something like a calendar in particular to keep reminding them. It's not a one-off reminder here. This is going to happen. Gran or granddad is going to come in and mind you. Mary's going to come in and mind you because I'm going to a wedding. You've got to keep preparing them in advance that these changes are going to occur. And you don't just land that parent into babies, or that other person in to babysit them on the day. They come and they spend time with them. They should be really somebody that they know well and they're used to being around. And there may be hitches, and you have to prepare for that. So the advice there is really you need to prepare in advance and prepare the child in advance for any changes that might occur. You know, the next one is supporting your child in any activities they wish to do. But don't overschedule them. So I'm talking about when they want to go back to doing activities. Now, sometimes they're not going to be able to do activities in person. Again, though, is there any way of doing these activities online? There's a lot of classes online that can be done. So, you know, think about ways of encouraging them to take part in a class, even online initially, but also then to start taking part in activities that they would have done previously, or maybe they want to take them up for the first time. So encourage them to do that, but don't overschedule them because they're going to get very tired. Sorry. Sorry. If they get overtired, then their anxiety is going to get worse. So you don't want that. Any anxiety or that, any other conditions are going to get worse. So, you know, you want them to get back into doing activities. You want to have them, you know, separating out from you a little bit. But then you might have to sit on the sidelines. You might have to sit in the room while the ballet class is going on or the music class is going on. But these are the things we have to do during these times. And it won't be for forever. It'll be only for a short time. They just need that reassurance and support from you at that moment in time. The next thing I would say to you, a couple more things is, and I promise only a couple more things now at this stage. They still need boundaries. They still need house rules. It's important that they have house rules. If they're a bit older, I'd say the 8, 9 and older, they can get involved in setting house rules. So these are the rules of the house. You know, if you break these, you get in trouble. And, you know, when they see them as being fair, when they see them as being consistent, then they're more likely to play along with them. They're less likely to have any hassle around them, and they'll stick to them. They'll stick to these rules, the house rules. Again, though, you might need to modify them, and it shouldn't be on big modified position on these. But please take your child's therapist's advice on this. But there should be, again, they need to know limits. They need to know you can't ease up on them. So if one child in the house is getting treated one way and the child with separation anxiety is getting treated another way, that's unfair. It should be the same. Maybe it's a little bit of a modification, but talk to the child's therapist. This is where they come into their own here, because they're going to get to know your child pretty well. They're going to get to know you. They'll possibly know the family as well, the rest of the family as well. So talk it through with them. Talk it through with your own therapist. And but for most part, the boundaries, the rules, the house rules, they should be consistent. They should be the same for all children in the household. The other thing about this one is choice. And I'm talking about choices in their personal life, like what to wear, eating, things like that. So getting them involved in making meals and things like that teaches them choices. What you're trying to do with giving them choices, small choices I'm talking about here. What would they like for lunch? Would you like me to drop you at the school gate? Would you like me to walk you into school? This is when they start going back to school. There's going to be small choices that throughout that you're going to be able to make with a child. With this, what you're doing here is you're giving them back a sense of control over their life. So with somebody like this, a child like this, they're going to have no sense of control over their lives. They're going to be feeling very anxious about their life. So they've no sense of control, have no control over this. So what you're trying to do here is by giving them small choices. So like getting them involved in making the shopping list, picking the meals for the week, picking out clothes, bringing a toy, to school. Things, like that, small choices. Again, your child's therapist is going to have a lot more suggestions around choices that you can give them, and how you can help them make those choices. But again, the whole goal with choices is to give them back a sense of control over their life and the situations that they find themselves in. And that's what you're doing here. You're encouraging this, that yes, you do have choice here. Yes, you do have control over your life. And the last and final thing I would say to you is you need to help your child by relieving your own stress. So reaching out, as I said, for your own support. You can work with me, you can work with somebody local to you, but you really need to get some support here and relieve your own stress. When a child is ill, whether it's a physical or mental illness, parents need support as well. They need a support group. They need their own therapy as well. The other thing is, when you're relieving your own stress and you're going to start getting back into modeling healthier stress relieving choices, your child is also watching that. Your teen is watching that. They're picking up on that. So they're going to start modeling those things as well. So think about it in those terms. It is not just about you relieving your stress. You're modeling better behavior for them. You're modeling the anxiety reducing behaviors for them. So have a think about that. And I will leave it there. As always, thank you all for listening. Good morning, Deirdre. As always, Deirdre's on every week, consistent, and that's why I give a shout out to her. Good morning to everybody else who watches. Thank you very much for watching, everybody. I know there's a huge amount of people watching replay. Thank you very much for watching, and I will leave it there. If you want some tips more tips and access to me for free, come over and join my mum's group in Facebook. I will be doing a full training on anxiety tips and separation, just separation anxiety, not separation anxiety disorder, but separation anxiety. I'm going to give a training on that next Friday. If you want, there is already a training up on on anxiety tips on how to help your child if your child just has anxiety. And I know a lot of kids would have anxiety going back to school at the moment. So if you want that, it's already up in the group. There's a lot of stress reducing techniques up in the group. And you can talk to me in there. It's free. Pick my brains. If I have an answer, I will give it to you. I'll go hunt an answer if I need to. And thank you all for listening as always. And I will talk to you all again next week.